You're listening to Medscape's In Discussion series on hidradenitis suppurativa, a podcast where thought leaders and clinical experts share their diverse insights and practical ideas for optimizing patient care. This series is hosted by Dr. Ginette Okoye. Dr. Okoye is professor and chair of dermatology at Howard University College of Medicine. Relevant disclosures can be found with the episode show notes on medscape.com or the Medscape app. The topics and discussions are planned, produced, and reviewed independently of advertisers. This podcast is intended only for U.S. healthcare professionals.
Hello, I am Dr. Ginette Okoye. Welcome to the Medscape In Discussion podcast series on hidradenitis suppurativa. Today we'll discuss the gut and skin microbiome and how they relate to HS with our guest, Dr. Tamia Harris-Tryon. Dr. Harris-Tryon is an associate professor in the departments of dermatology and immunology at UT Southwestern Medical Center in Dallas, Texas. Her research focuses on how the immune system, the microbiome, and the skin barrier all work together, or sometimes against each other, in chronic skin conditions like HS. Thank you for joining us today, Dr. Harris-Tryon, and welcome to the Medscape In Discussion podcast.
Thanks so much, Ginette.
I have been really excited for this conversation today because certainly there's increasing interest in the role of the gut and skin microbiome in skin diseases. And this interest isn't just among healthcare professionals, it's among our patients too. And I think our patients are taking probiotics, especially those who are more interested in holistic care and those who are on antibiotics. But I would love for us to try to empower dermatologists and other healthcare providers to really understand the science here so we can help our patients make informed decisions about this aspect of their care. So thank you for being willing to guide us through that conversation. Why don't we start by you telling us your connection to HS?
My connection to hidradenitis suppurativa predates my connection to the microbiome. I trained at Hopkins in dermatology. Dr. Okoye was my attending, and we saw a lot of patients with hidradenitis suppurativa in the practices there. And I think what struck me is how much suffering there was and how little knowledge there was with respect to what was causing all of these, festering wounds in the armpit. We were putting people on biologics, but only a third of people were responding to them. These are some of the best medicines we have. Some people would respond, but even then, I would call the response partial. People weren't going back to their normal lives and normal high quality of life, and they were still suffering. It became clear that we really needed to learn significantly more about hidradenitis suppurativa and try to make a difference in our patients' lives.
Absolutely. I agree with that. So, do you see patients with HS now, and how do you work in your research on the microbiome into your care of these patients?
Yeah, it's an excellent question. So I spend about, 80% of my time running my basic science lab that focuses on the skin microbiome and the immune system. But when I am in clinic, I see at both our public hospital and also in my private practice, I see patients with hidradenitis suppurativa. And when I see those patients with HS, what I really want to impart onto them is that this is a whole body condition, and that if we can do things to strengthen their immune system through modifying behaviors in their life, that we can make a meaningful impact in their disease. And that every medicine I prescribe, I still prescribe a lot of medicines, they'll all work significantly better if we can also make some changes in lifestyle management, smoking cessation, nutrition practices, increasing activity, physical activity in their daily lives. If we can do those things all together in concert and take an integrated approach to their health, we'll make significant gains and get people hopefully into durable remission with their hidradenitis suppurativa, and they can go back to a high quality of life every day.
Yeah, I love that goal. And you mentioned an integrative approach. How do you manage that with your patients?
The way that I approach a lot of integrative health questions now with my patients with hidradenitis suppurativa is to help them understand that the skin microbiome is imbalanced in hidradenitis suppurativa. There are bacteria growing and existing in people's armpits and groins, buttocks, and under the breast in hidradenitis suppurativa that we just never see in patients who don't have a hidradenitis suppurativa. The lens that I take towards it is, how do we get that balance to be restored? One of the first things we talk about is diet. And diet is such a hot button issue. It can be so sensitive for people. I focus more on things we can add back to the diet and then some major things that we need to take away. So the one major thing I say that we should reduce is high sugar foods. In medicine, we also often call these high glycemic index foods. That's like sweetened juices, sodas, things like that. Sweetened tea here in the South, we love our sweet tea. And so, in order to partner with my patients, I often say we don't have to get rid of those entirely, but cutting back the sugars to maybe once a day if you're having them many, many times a day. And then if you're having a sweetened drink once every day, maybe cutting them back to once a week. So we just talk about risk reduction, and sugar is the first place I start. In partnering with that too, when people are thinking about diet, they're often thinking about restriction. I also try to emphasize that we can add some yummy things back. What's your favorite vegetable that you actually enjoy eating? Maybe being intentional about adding those to the diet every day. And if they're already there every day, maybe we can add them to every meal. And also placing sweet drinks as a dessert and as a treat after a meal, and not as the main focus of your nutrition, and understanding that skin and nutrition, they go hand in hand. The last piece is also fats in the diet. Modern diets sometimes are low in fats. And so I really emphasize that that the skin is the largest organ of the human body. It needs a lot of fats in order to function optimally. And so making sure you get those nutrients is really going to make a good impact in the skin.
It must be a really different conversation to have a quote unquote diet conversation with a patient where you're saying you can actually have more fat, right? I think that's a really nice way of having what could be a fraught conversation. But your recommendations for nutrition, they're related to your thoughts and your research about the microbiome. So let's take a step back and teach us a little bit about the microbiome and how it relates to those recommendations.
I was really fortunate to do my postdoctoral fellowship in a gut microbiome lab here at UT Southwestern, Laura Hooper's lab. If you're in a gut microbiome lab, you start to realize that the microbiome in the gut and nutrients in the diet, they go hand in hand. Every time you consume something, our body's going to do some of the work of digesting that food and also extracting the nutrients from that food, but the microbes are also doing a part as well. The easiest example is fiber in the diet. So if you have any plant-based food, you have a salad today, even if you have wilted spinach today, so even if it's cooked vegetables, our body can't digest all of that spinach. We just don't have the enzymes to do that. And that's not bad, and it doesn't limit us, because in our small intestine and in the large intestine, we have a series of microbes that can do that digestion for us. They can digest plant polysaccharides. So the big fiber molecules, there are species of bacteria that do that work very well, way better than we do. When you give those microbes the food that they need, they grow and they expand. Those populations that digest fiber expand. And it turns out that the microbes that digest fiber make all sorts of small molecules that are highly beneficial for our immune system, highly beneficial for our brain, and highly beneficial for our skin. And all of those things working together in concert help strengthen our immune system, and also help strengthen our skin barrier.
And so these bacteria, do they exist from birth or do they change depending on what you eat throughout your lifetime? And can you change them? Can you adjust your microbiome?
It's been shown in mouse studies, human studies, large population studies from all over the globe that what you eat will drive your microbiome. Some of the original studies were done in groups of human populations that shift their diet significantly with seasons. During the seasons where you had a high fiber rich diet, your gut microbiome expands to be full of microbes that digest that food. During the seasons where you don't eat that same nutrient, those microbes go down, and the microbes that metabolize what you are now eating will go up. So we know that that's true. And it happens over the course of weeks, not over the course of months. And it can happen even faster too. But if you change your diet at the end of that week, your microbial communities, we would expect to shift a lot in the gut. And then we are born mostly sterile at birth, to answer your second question. Babies are somewhat sterile at birth. Their skin microbiome gets colonized by their method of delivery. So if you're born vaginally versus if you're born by C-section. And then your gut gets populated again by the diet of a baby. If you are getting breast milk, that's going to tune you to have a certain microbiome. And also formulas, which we've tuned over time to be a lot like breast milk, are also going to have an impact on the microbes that respond to that nutrient early in life.
Hmm. And so, are there data showing the types of microbes that tend to occur in patients with HS in terms of the gut and the skin?
Yes, there have been some papers. It hasn't been entirely definitive what microbes are associated with hidradenitis suppurativa in the gut, but we know that there are decreases in fiber fermenting microbes. More than what expands, we know that in the populations that tend to get HS, we see fewer of those fiber fermenting bacteria.
And so that's what's driving your recommendation to increase fiber, increase, I guess, vegetables and fruits in patients with HS then.
Yeah, vegetables and fruits and lowering the sugars. And then every single interaction you have in your life will have a tuning effect on the microbiome. For example, we know that our hidradenitis suppurativa patients smoke more. We know that there are specific species like Porphyromonas species that are more associated with smoking. These links are known. It's diet, but also other exposures like smoking have a big impact on the oral microbiome. And so, what that microbes grow in your mouth will also impact microbes that end up in your gut.
Hmm. So how does a high sugar diet affect the microbiome?
So I think it's twofold. If you have a high sugar diet, you also probably have a low fiber diet. So it's the two things together, the fact that it's high in sugar and then low in fiber. We don't exactly know the mechanisms. If you have high sugars, you'll get high amounts of insulin. And we know as dermatologists that we see a lot of rashes that come downstream of that. My lab is actually trying to dissect some of these questions right now on the bench. What exactly is changing? And so I have less data for that and less direct links to the microbiome. But that is part of my practice as a physician. Just if I lower those sugars, patients do better.
And there are lots of other good reasons to
Yes.
decrease sugar in the diet anyway, right?
I emphasize that to my patients for acne and for hidradenitis suppurativa. This is the organ we can see. But all of these changes, we have decades of medical literature saying that this is good for your heart, your liver, your kidneys. And so it's very affirming for me as a physician to be able to motivate people to make whole health system changes to their life that impact the organ they can see every day, which is their skin.
Yeah. And when you talk to patients, in a really non judgmental, relationship affirming way, they will often identify those foods themselves
Yeah.
as foods that tend to flare their disease. So this is fantastic. It'll, I think, help inform some of our conversations with patients so we're not just arbitrarily saying decrease sugar, increase fiber, have more fruits and vegetables, but we can explain to them why, especially if they are showing interest in more integrative care or they're asking about dietary changes or probiotics or
Right.
something like that.
I've had so many patients who say, my HS was terrible. I decided to drop my soda consumption every single day and my skin cleared up. When they come with those stories, it's very affirming to me that this practice people get a lot of benefit from.
Absolutely. And I think it's important to note that this is part of the practice. So, yes, we could still treat with antibiotics, we could still treat with biologics, but why not also incorporate this into our care? It'll help the patient's overall health. So, anyway, I know I'm preaching to the choir.
Yeah, absolutely.
When I think about foods, I always think about the impact of kind of the system, right? Some public health factors that we know impact food choices and so on. What are your thoughts on like public health interventions or systemic interventions that as a field we should think about for patients with HS when it comes to their microbiome?
Yeah, I think on a systems basis, I think this is critically important. We have a lot of data on what makes populations thrive and healthier. Access to nutrient dense foods that are affordable and accessible. They've actually done some studies to show that it's not necessarily more expensive to have a diet that has nutrient dense foods, But access is an issue. How do people access the grocery store? How do you physically get to that grocery store so that you can get the groceries that you need? And so I think that's a major issue. Here in Dallas, our food pantries are helping to fill some of that gap with a lot of education and a lot of access to foods. And then, food as medicine programs that are allowing physicians to shift their practice so you can start prescribing foods so that we can write prescriptions for foods that we know that are nutrient dense, fiber rich, that can really have an impact on health. So I think that's one major one. I do also think there are a few other things that we can help patients with. I was fortunate to be at this meeting last week that we were talking about. The American Heart Association has talked about all of these different metrics that help with hypertension. Many of those help with other things too that we see in dermatology. Making sure our patients know that sleep and stress are going to modify their immune system and gut microbiome and disease. Allowing people to live in walkable, safe communities so that they can get the exercise that they need and the steps that they need, because that is also a component of how you optimize metabolism, which ends up having a big impact, positive impact on skin. All of these issues are systems issues, they're public health issues, and addressing them will help with HS. Again, to come back to smoking, whatever we can do to encourage smoking cessation is also going to allow all the medicines we prescribe for HS to work better. It is, so clear that patients who smoke are at higher likelihood to get hidradenitis suppurativa. So all of these are big public health interventions we can make in order to have an impact on our patients.
Yeah, so systems level zooming out, but clearly you already led with the things that we could do one on one with
Yes.
patients to help them and ultimately their families, because often we see women of childbearing age with HS, and so they
Yes.
may be preparing foods for their children and their family, and so we could have an exponential impact that way.
One other thing I try to encourage my patients to do is to use less packaged foods. They're foods of convenience. They're
Hmm.
part of everyone's diet, but I think just being conscious that foods that are shelf stable definitionally are missing some nutrients that we need. That in order for them to be shelf stable, there's nutrients that aren't shelf stable that we do need. And so I have that conversation as well with my patients.
So, what are your thoughts on probiotics? Do you think they have a role in the management of HS and other inflammatory disorders?
And so we talked about kind of like my stepwise approach. First, cut back on the sugars. Next, focus a lot on what we need to add back, those fibers, those fats, and healthy proteins. I always say if people still want to talk about it, then we move on to probiotics. My approach to probiotics is also supported by a lot of other microbiome scientists, is to focus on fermented foods. There are so many fermented foods that are ancient in human history, and we know that a lot of the microbes in those foods have been shown to be beneficial to all aspects of human health. So if you take yogurt, probably the most easily and readily available fermented food, it often has lactobacillus species in it. Those have been shown to be beneficial microbes, and they make a lot of products that are good for the immune system. They often also have bifidobacterium species in them. We know too that when you're eating it with the fermented food, in the case yogurt, you're getting the live microbe. So if you turn over any container of yogurt at your grocery store, you'll see they'll say live active cultures, and they'll actually list the species that are in there. Foods are also approved by the Food and Drug Administration. We've had them in our history as humans for millennia. So we know they're safe. We know that humans have been eating them with benefit for a long time, and they're also well controlled. We know what active species are in them. So for all of those reasons, I think it's great to start with a fermented food like yogurt, other ones like kimchi that are ancient, sauerkraut, kefir yogurt drinks. All of these foods we know are full of microbes that have now been shown with all of our scientific tools to be very beneficial, but actually for millennia, humans have been
Oh,
using.
so our ancestors already knew.
Yeah, it's amazing.
Are there any other fermented foods we could mention besides, you said, kefir, yogurt, kimchi, sauerkraut?
Jeanette, you and I are both from the Caribbean region. And my family's from Guyana. We have drinks like fly and mabi, ginger beer. Those are just from the region my family happens to be from. I know in West Africa, even their fufu and these other pounded grains, They have to be
Are
fermented.
left to, yes.
Yes, they are. My lab is actually full of people from all over the world. And so I often ask questions about their fermented food practices. Bamboo shoots are often fermented in many parts of the world. Dosa, some of the people in my lab point out that dosa dough, I didn't know that. I love dosas, but dosa dough is actually made and then left overnight and fermented. I'm not sure what species are in that, but I was saying
Mhm.
we should study that in the lab. I also think it's important to note, though, I will say that I do think one thing that microbiome has helped me align with is, how you feel is important. If you eat some of these things and your stomach is, your digestion is upset, you don't have to eat things just because of this. I think it is important to center how you feel after you eat. And that's also what microbiome science has helped me understand, and thinking about the skin too. If your skin reacts negatively after a few days of something, move away from it, and if your digestion reacts negatively after a few days, move away from it. I personally can't tolerate a lot of fermented drinks if I drink too much of them. So I don't drink too many fermented drinks if they have, too much gas in them, I guess, too much carbon dioxide. But many other fermented foods I tolerate well. So I think there's so many fermented foods throughout human history. And then
Mhm.
remembering to always align how you actually feel after you consume something.
Yeah, I think that's important to follow up those recommendations to patients with, so that they don't feel like they failed, right? I tried kombucha and I felt terrible. Well, okay, try something else. And I think it's always nice to tell people, think about your people. Where are your people from, and what have they been eating for millennia, and try that too.
Yes. A really beneficial diet is the Mediterranean diet. And one way that you can understand how the Mediterranean diet might be used in different food contexts throughout the world is through the website oldwayspt.org. And they've actually created food pyramids that reflect Mediterranean diets, not just from the Mediterranean, but from the African continent, from Asia, from the Americas, so that everybody can have access to that. And the website again is oldwayspt.org.
That's really interesting. So, Dr. Harris-Tryon, this has been absolutely fascinating. Do you have any parting words for us?
And your skin is telling you something about your health, is probably my parting word. It shouldn't be itchy. It shouldn't be inflamed. It shouldn't be red. And it does need care, but that care doesn't always involve a 15-step, highly astringent regimen that's expensive. I think more it involves taking care of your body through making mindful choices of what you're ingesting, getting good movement several times a week. The body needs that for its metabolism. And then, as dermatologists, we love a great moisturizer for a reason, because the skin needs lipid, both in the diet, and then, if your skin is dry, you want to add a little bit more lipid to it. If you feel like your skin is oily, then you can shift away from that too. But I do think trying to find a skin balance where your skin is not inflamed is an important part of health.
Today, we've talked to Dr. Harris-Tryon about the gut microbiome in HS. And some key takeaways from my perspective include the fact that what you eat absolutely changes your gut microbiome, and that change can happen within days or weeks. And that encouraging our patients to have a higher fiber, lower sugar diet can sway their microbiome towards the types of bugs that we believe are more beneficial for inflammation in the skin. Thank you for joining us. Please take a moment to download the Medscape app to listen and subscribe to this podcast series on hidradenitis suppurativa. This is Dr. Ginette Okoye for the Medscape in Discussion podcast.
Thanks for listening to Medscape's In Discussion Hidradenitis Suppurativa podcast series with our host, Dr. Ginette Okoye. Be sure to look for more In Discussion episodes wherever you get your podcasts. Check out medscape.com or the Medscape app for show notes, links, and more information on hidradenitis suppurativa.